So if you've got a headache, there is a few maneuvers that you can do that will help. So the first one that we're going to run through is antler twist. So for antler twist, we're going to use the palm of our hands. We're going to place it on the temple area. So with your right hand, your fingers are pointing backwards. With your left hand, your fingers are pointing forwards. You're going to push in, and then you're going to turn, and your face should look a little bit like that. Then we're just going to rest our fingers on our head. And you're going to move your head around really slowly. So remember, fascia likes to move slow. And the other thing fascia needs to open up is your breath. So you're going to breathe 3 times through your mouth and 3 times through your nose. You can squat down. All right, and let it go. So the antler, often we have built up pressure and tension, and our fascia is all restricted and pulling. So as we do this, this really shifts all of that tension and can even move some of the structure within the bone structure and allows that all to open up. We're going to continue with opening up some of the structures. So if you were a C-section baby or you've suffered a head trauma, which, let's be honest, not many of us get through life without banging our head on something at some point, everything can get fused. And so the blood flow and the oxygen's just not getting there, particularly in the frontal lobe. So we're going to use a claw, and we're going to put it just on our hairline. Doesn't matter what hand, whatever you feel comfortable with. And we're going to push down on our head, and then we're going to pull the skin forward, and we're going to place the other hand on our top of our head and pull back. So you should feel that real stretch and opening at your head there. And again, we're going to breathe. 3 breaths through your mouth, 3 breaths through your nose, as you really slowly look around, getting the different angles. You can squat and letting it go. And the last one is the posterior cranial release. Helps with the atlas, as well as just opening up the back of the skull. So we're going to use this motion. We're going to travel up the back of our neck where you've got that like indent, that valley. So up the back there, you're going to push in and you're going to pull it apart. So you've pushed in there and you're pulling it apart. And we do the same. Gently moving around, getting the different angles. Doing your 3 breaths through the mouth and the 3 breaths through your nose. And letting it go. So there's 3 really quick maneuvers, only taken like 3 minutes to do some shifting in your brain, in the tension, to relieve some of those headaches and migraines.